Happy Monday after a very long weekend. I hope that you didn't have a turkey sandwich for your lunch today because I don't want the tryptophan to put you to sleep. We'll do our best to keep you awake and make this a meaningful experience for you. As Allison so generously did introductions, I'm Eric Hufnagel, the Executive Director of the Michigan Coalition Against Homelessness. I'm joined today by Lisa Chapman, our Director of Public Policy. We're going to be tag teaming a bit as we have done over the years, and we're happy to talk to you today about the annual data report that is put out annually that we, as Allison said, are heavily involved with, and it's linked through the Campaign to End Homelessness. We would like you to be thinking about the data through the lens of advocacy and how can you use the information going forward. I will just simply give a gentle chastisement for those of you who haven't read it yet. I'm so disappointed, but as Allison said, it's a busy time, so I fully understand, but I know that you're going to be able to get a little flavor of things based on the presentation today, but I would encourage you to actually access the report and go through it. It's not a 100-page document with a ton of narrative. It's a relatively easy to read document that provides a lot of great information, breaks things down in a way that I think would be useful for you. And I would suggest you take a look at it because that will help with an understanding of the presentation that we're going to be giving today as well. But it's important for you to be able to know what that data is and the information in that report to be able to communicate, I think, effectively in your community. So again, I encourage you to take a look at it. I don't know if that's something we can drop into the chat box or not during the presentation, but I'd like to have everybody have access to that whenever they have a chance to do that. So with that said, let us have another slide. Thank you very much. So just roughly an agenda for today, we're going to be spending some time talking about the data report, as you should understand based on the title of this presentation, and thinking in terms of the state level, how it relates to the goals of the Campaign to End Homelessness and the plan to end homelessness that is put together through the campaign, and then also thinking in terms of collaboration. So we're going to talk a little bit about advocacy versus lobbying, so you're grounded in what that is, and thinking in terms of how this information might be used by you for what purpose. I want you to keep in mind how you might go about using this information. We're going to talk a little bit about advocacy and policy work at the state level and the local level, about how you could use this data and storytelling, media engagement, working with elected officials, and also thinking in terms of how is this information going to be useful for you in telling a story that reinforces your fundraising activities as well. Next slide. Okay, so let's start off with advocacy versus lobbying. It's not a competition. I just want to describe to you the differences between the two. And this is a very simplistic way of looking at it. I think it's very important because a lot of people think about lobbying as something that is verboten, that it's something that you shouldn't be doing as a nonprofit, that it might put you in jeopardy if you pursue lobbying. And then what compounds things is the confusion that people have about advocacy versus lobbying, and that those are two different things. And I want to be clear about that. So I want to ease your mind about being able to use this data in a way that doesn't make you uncomfortable in thinking that it's lobbying. Advocacy is simply seeking public support for or recommendation of a particular cause or policy. So that is you talking about how policies might affect the work that you are doing. So policies or cause supporting the issue of combating homelessness. Lobbying is different in the sense that you might be asking for support for something, but it's tied typically to a specific piece of legislation or trying to influence legislation. So when you're thinking about elected officials, you're thinking about, state council, or excuse me, the city council member, state legislator, member of Congress, and you're thinking about specific legislation and you're engaging in communication with them about that specific legislation and encouraging them to vote in a certain way. That's typically what you're doing when you're lobbying. You can talk about the issues that are related to that legislation without specifically asking for a specific vote for or against something. So you can still pursue advocacy in a way that is not lobbying if you're not engaged in talking specifically about a piece of legislation. Okay. Next slide, please. So what is that purpose of advocacy? You don't want to boil it down to, at the basic level, advocacy is building relationships. That may not sound very sexy, and it may not be what you were thinking it was, but advocacy is something that is done in many ways for many reasons, but it's building relationships. So when you're thinking about how you're approaching what is actually advocacy, it's how are you communicating in a way that's building relationships and helping to educate. So some of the ways that you can do that, or reasons you would do that, would be educating policymakers. And those could be elected officials as well as those who are non-elected. And what I mean by that is, if you're talking to your city council member, that's an elected official. If you're talking to your city manager, that's not an elected official, but they are policymakers. They can influence policy that takes place at the local level. So what you're trying to do is educate them about the issues that affect the people that you serve. Another reason to engage in is impacting regulation that affects your organization. So we're talking about how you do business, and that would be local policies, state policies, federal policies, and sometimes it's how funding sources also regulate the work that you are doing, and educating about the impact of that regulation. But then there's another reason that you can engage, or method of engaging, which a lot of people don't think about, and that is building relationships with the people that can influence your community. So this is bringing it down to that local level again. Who are some of the people who may be considered movers and shakers in your community, who may not have elected positions or may not actually be working as policymakers within your county or city government? There are people, I think if we put our minds to it, we can think about those people who can affect change in our community, who have connections, that have the ability to communicate with others, who can take a position on things. And I don't mean necessarily some legislation. I'm talking about someone who can be an ambassador or otherwise carry your message further based on the fact of the connections that they have and the gravitas that they have as well, if they're seen as a respected leader in the community. So keep those things in mind. It's not just about an elected official. There are other people as well that you want to be advocating with. Next slide. So now I'm going to be turning it over to Lisa Chapman, who's going to be leading us down the path of the righteous. So Lisa, why don't you go ahead and kick off the next few slides.
Sure. Thanks, Eric. And thanks to everyone who's posting in the chat. We're sending you some of those links and those resources and the data report so you can have it handy. But I did also want to mention something, about what Eric said about working with policymakers and local officials, and, using your particular data and your stories are really helpful to them to paint a picture, a full picture about what's going on in the community in regard to, people experiencing homelessness and the lack of housing. And it's really important that they have kind of a full picture of the landscape, so that will help them do their job better in allocating resources and, pushing policy that will help impact those issues. So here are the overall themes from the data report. And I'm glad to see that some of you read it, some of you were on the webinar, and the ones that couldn't, I totally understand. We thought we were busy before this pandemic, can't even compare to now. So we'll give you the highlights and some of the themes. Number one, there was a decrease from 2019. And most communities in Michigan saw a decrease, and it was 19% overall. That was an average for the state. Your area could have been higher or lower, and definitely you want to highlight that. There was also some racially disparate impacts from COVID-19 that were seen. We're going to talk a little bit about what's behind the decrease in numbers and what the data report showed. It may be similar to what you experienced in your community. We want to talk a lot about, and this report really deviated from 2019 in that, we were dealing with a pandemic from March 2020 onward. And so how did we pivot? How did the system change? What had to happen to necessitate some of those changes? And then what were the innovations and lessons learned from the COVID challenges? So if you were writing a story, maybe of your COVID experience in your community, in your organization, would these be the themes that you would follow also? Is that what you experienced? And what is your data telling you? How would your headlines differ at all from these? So how, thinking about how you would tell your story over the last year and a half. Thank you. Next slide. So just want to emphasize, these are the Campaign to End Homelessness Michigan goals. These are the themes. So increasing access to housing, kind of cross-sector collaborations to impact the social determinants of health. And I know we have people from many different sectors on this call. So, we have to cross over sectors to really impact people experiencing homelessness. Enhancing the homeless service delivery system, how we do that collaboratively. And then mitigate the risks. So increasing some of the prevention and diversion efforts to lessen the risk that people will really fall into homelessness. So it's really important to emphasize, if you're doing advocacy or speaking to local media, networks, municipal leaders, and policymakers, that each local continuum of care and planning committee are part of a larger network of homeless response at the regional and local levels, as well as the state level. So we all have the same goals or similar goals that we're working toward. We use the same data system. We use the same assessment tools. We collaborate across the state to really improve the systems and share information and best practices and lessons learned, because we're all learning and we're all kind of innovating as we go here. So I really think that, in doing your advocacy, emphasizing that we're a collaborative effort, all working toward the same general goals is really important. Next slide, please. So a little bit behind the decrease in numbers. A couple things that the data report really pointed out in particular that they cited. It could be different in your community, but these, themes and reasons seem to really cut across all the communities. So the first one was the eviction diversion program and the millions of dollars that each community had for funding, as well as other rental assistance, but primarily EDP was the main one and the priority that was a big factor in keeping people stably housed, and really was an overwhelming success in the summer of 2020. According to the Poverty Solutions Report, leading to virtually no evictions. I won't say none, because we know there were some, but virtually none. And later in the year, when evictions did start to rebound, we really saw that there was a 30% overall decrease from the prior year. So that was a huge success. And furthermore, nearly 33% of tenants that did happen to participate and get summoned in eviction cases were represented by legal counsel. So that's a huge win. And that really seemed to help folks avoid evictions in the end. The second reason is the eviction moratorium that we had. There were several in place, if you remember, at that time, at the federal, state, and some local levels. So these moratoriums allowed renters to stay housed during the height of the pandemic. They could post the CDC notice on their door, let their landlord know that they were impacted by the pandemic, and people were not evicted into homelessness, mostly. So that was a good thing. According to the 2021 Poverty Solutions Evictions report, there was a 65% decrease in eviction cases that were filed between April and December of 2020 compared to the same time frame in 2019. So that was huge. So that was a big win, and that really helped drive the decrease in folks falling into homelessness. The third issue was that individuals and families chose not to seek services. So if you remember back at that time, and even still to this day, you know, shelters had a concern about people congregating together. So some people chose not to seek those settings and really look for other options. Some people doubled up with family, and many communities actually saw a rise in homeless encampments during that time as folks chose to be outside rather than to, you know, risk and choose not to be in closer contact with others. So that was really another thing that kind of drove down the numbers. And lastly, then the stay-at-home executive order that we had at the state level, this resulted in people not moving around as much. Again, doubling up with others, as well as really the overall decrease in the shelter capacity as they social distanced. You couldn't have as many people in, you know, a space, as well as people just not being evicted and staying put. So what did this mean for your organization in terms of changing how you worked, what approaches you employed during the pandemic? How do you approach services for folks that were experiencing homelessness? Did this increase your costs? Did it increase your staffing? Did it change or increase your use of technology perhaps as you did, you know, virtual meetings with people? So what impact did this have on your bottom line as an organization or on your community? These are all really salient points to consider and think of sharing with the media, with your funders, and with policymakers when you're doing advocacy. And talk about what you were seeing in your data and the impact that it had overall. You can go to the next slide, and this is Eric. Turn it over to him.
Thank you, Lisa. Appreciate that. Nice job. Well, let's talk about racial disparities. And I think it's pretty obvious for us when we think in terms of people of color being disproportionately affected. Black and Hispanic populations have been hit especially hard by the pandemic. You probably know that anecdotally in your community. You probably know that from some of the data that you have in your community. But breaking that down a little bit on a statewide basis, if we're looking at that, in the fourth quarter of 2020, unemployment rate for Black population was more than double that of the white population. So that is one specific example where the pandemic has created a much greater impact on persons of color. Also, white renters are substantially more confident in their ability to pay rent than Black and Hispanic renters. That's based on data and looking at people's assessment of their current situations or their situations at the time and their ability to maintain rent payments. COVID-19 spread much more amongst persons of color. Black and Hispanic populations saw significantly higher percentages than the white population. And then correspondingly, we also saw the death rate from COVID-19 in the Black population 3 times the rate of the white population. So as we're thinking in terms of the population that we're working with, people who are affected by homelessness or at risk of homelessness, we can then see that racial disparity relates to those numbers. And so if we're talking about racial disparity within homelessness, we should also then be thinking in terms of the messaging that we have and what are we conveying to the public about that disproportionate impact, particularly with respect to the pandemic and how that has affected people. Next slide. So I'm going to talk a little bit more about the COVID impacts, and one of the things that I think it's important for us to be able to do is to talk about how this impacted the way that we are doing our work. So we know that with respect to sheltering and social distancing, that impacted the capacity within the system. The number of beds that were available in all communities shrunk. And I think that we need to be talking about that as I engage in conversations with reporters, with the media. They're interested still in that issue. They want to know how that's impacting the work that's being done, and being able to talk about that effectively, I think is important. And so where have people gone is the question if they're not sheltering. We also know that COVID increased the use of motels and hotels. That's something we should be talking about as well, and how that's impacted our bottom lines. But also, I think one of the things that we need to be talking about is what are those positive things, if you can pull a silver lining out, what are the positive things that we have experienced as a result of how we are adapting to COVID? And certainly the relationships that have been established, the partnerships with hotels and motels during COVID's peak. I think most communities can acknowledge that they were able to develop relationships in a way that they had not been successful in the past with respect to hotels and motels. But we also know with respect to COVID that there was a lack of housing vacancies, that people were staying at home. Stay-at-home orders were in place. And so we didn't see people being as transient in the sense of moving or needing to move into other housing. And so the vacancies were limited. And we still see that today, where the vacancy rates are low, and the ability to find alternate housing for those who are experiencing homelessness is extremely difficult, more of a burden than we have ever seen, I think, in the past. COVID also has increased the demand for services and housing based on calls. So the volume, and this is consistent, we know that today, even more so, the volume of contacts that you as communities are receiving does have a direct relationship to COVID and the impact of COVID in the long run. We also know that COVID impacted evictions and the eviction moratorium, and that's messaging that we should be sharing with folks about how we have seen people stay housed and the data that's out there. And I know Lisa referenced that there's a lot of data that's showing the impact of the eviction moratoriums in keeping people housed. There were still evictions, we know that, but we need to be talking about how important that was to maintain housing, and what the impact is now that we are seeing evictions underway in a little bit more robust fashion. Even though there is an eviction diversion program in all communities, we still are seeing evictions taking place and the pressures that we are seeing as a result of that. No, let's back up a little bit before we jump. There we go, a little ahead of the game there and moving ahead. I wanted to talk a little bit about some of the unique aspects at your local level with respect to COVID and some of the things that you had seen. As I had mentioned, one of the things that is a silver lining would be some of the new partnerships that were developed. And how are we talking about that when we are engaging in our advocacy work? Because I think it's important to show that indeed, as a system, we have been able to adapt. We think about new relationships with landlords that we may not have had, or strengthening that. We're talking about new stakeholders at the table. Health departments, I think, are a prime example of that. Most of you in your communities have seen much more engagement with representatives of public health departments than you had probably seen in the past at your COCs. And that's a positive thing. That's something that you can build on. That's the relationship building. Again, hotels and motels, a silver lining of having better relationships with many of those. But there are other things that have been done as a result of COVID. And you can be talking about this in your messaging, doing things differently, the service hours being different, or the way that people can access assistance as opposed to face-to-face or by phone, able to do it remotely. So we need to be talking about those changes and some of those things that have developed that we think actually have some positive impact on how we're carrying out the work. So I would like to ask right now if people wouldn't mind sharing some of the ways that they have been impacted, some of the positive things potentially, or different ways that they've had to operate. We've had some suggestions already from folks. Esther had suggested that great ideas, cross-sector work and common homeless definitions. That is really a positive thing when we think in terms of working cross-sector where maybe we had not before. I used the example of public health departments where the language may have been a barrier in the past, even if we did not even realize it. And how are we trying to use common definitions and language that we can all understand? Susan Conrad suggests that her agency recently received a community coordinated behavioral health center grant. In some ways functions in the intersection of various social determinants of physical and behavioral health. Very excited about the possibilities it creates. Yeah, different opportunities that are being created that you may not have encountered in the past or participated in the past. Yeah, and somebody was asking what SARA stands for. Was that typed in? Yeah, COVID Emergency Rental Assistance. Just wanted to make sure that we don't leave anybody behind because we're living in a world of acronyms, and we apologize when we use acronyms and forget to spell out what those actually are.
We had another comment in the Q&A, Eric.
Okay.
It says, it seems that the reduction in evictions ironically also leads to a reduction in the availability of housing stock, which seems to be a key advocacy point. That
is an excellent point. I'm glad that you brought that up because I don't know if you'd say that's the law of unintended consequences, but the reality is you are correct that as we manipulate the system, supply and demand, which we did through the moratorium, once we open that up, the equilibrium is thrown off a bit. And the public, I don't think necessarily has an awareness of that aspect. The eviction moratorium, I think people can understand that's keeping people housed, but thinking in terms of not having access to housing once they are moving out of an eviction process is something we need to talk about. With my communication with the media, and I'll refer to that again because I try to touch on some important points, but I talk about the front door and the back door. As many of you have heard, or if you've not, let me just use this. And I didn't create this, I'm just sharing what I've heard from others. But when you think about homelessness in the way of how many people are coming into homelessness, how are you trying to close that front door, slow the entrance in the front door to help keep people housed? That's one aspect that's very important. But then again, we also know, and your question or comment I think is really pertinent here, the back door is once people have come into homelessness, how do we help to move them back into housing? So that's the back door. You have people coming in and people coming out. So if you can slow down the front door, then you are less challenged on the back end in maintaining, but you want to move people out as quickly as possible. We know that. And the less housing stock that is available, the slower that process is in moving people out of homelessness. So that is an excellent advocacy point to be talking about. Any other ideas or suggestions that anybody has with respect to COVID and how that's impacted how you're doing your work? Any positive or negative ways that you've been impacted at the local level through your agency or through your community? Anything else anyone would like to share?
I'm not seeing anything come in right now.
Okay. Well, great. Well, now, next slide, please. We're going to turn it over to Lisa.
Thanks, Eric. And one other thing I wanted to mention about, the stay-at-home orders and the lack of housing stock in the eviction moratorium is that also before the pandemic, we were already behind in production or, rehabilitation of affordable housing. And so this really exacerbated the whole issue and really brought it to the forefront. So it's a unfortunate thing, but you can use statistics like with the emergency housing vouchers that HUD put out during the pandemic that are supposed to be getting leased up right now. You can say we have so many people that are eligible that have a voucher, technically or theoretically in hand that are looking for housing and can't find a unit, can't find a landlord, can't find an affordable unit that, meets the criteria. So that's a great way of, highlighting a sad statistic that is, reality for the homeless response system right now. So I just wanted to throw that in as well. In terms of challenges, we all lived through this, so a lot of you could probably add to the list, but this is really what the data report cited, and some of the big categories. Remember in the early days when you couldn't get your hands on masks and people were making them, and then you couldn't get your hands on materials. We couldn't find hand sanitizer in the stores, not to mention paper goods. So that was really an issue. We touched on sheltering and the need to pivot to non-congregate sheltering, and use of motels and partnering with different business people. One very sad statistic is that there was a great increase in domestic violence calls and issues with people, sheltering in place and staying in place, and unfortunately put a lot of relationships at risk that were on the edge. And then, of course, we talked about the lack of rental inventory and staffing shortages. And so, I really want to have you highlight and think about, how did you manage these shortages? Maybe some of them we're still dealing with. Was this consistent, these themes with what you were seeing in your community as challenges? What else would you add to the list? And, really in your advocacy and in your work with partners and, the media and your funders, highlight the unique challenges that you had. I'm sure you had higher costs incurred in the beginning, or maybe you still are, or maybe some unique connections that you forged. Like I know that really in a lot of communities, the public health departments really stepped up and really partnered and really, helped get testing out there, and then vaccines. They got PPE and plastic barriers and all kinds of things that communities and organizations needed that were really in short supply. So that was a huge thing. What other partnerships did you forge with landlords or Fqhcs? I know in one community, the Fqhc put on the vaccine clinics and got a lot of staff and participants vaccinated. What are your ongoing needs? Landlords certainly are one of them. I probably would say that staffing, is a huge one for a lot of communities. Sorry, Fqhc is Federally Qualified Health Center. Thank you. So this is a great opportunity to tell the stories about families and individuals and how they were impacted, especially if you don't have hard data in an area. You can tell a story of a family that, couldn't find a unit, had a voucher, or thankfully were not evicted. They had some, great representation, and they had a judge that was really wonderful, or some, those are the stories that really put a human face on the issue, especially when you don't have, hard data. So it really helps to drive home a point and put a human face on some of the challenges or issues of, for example, domestic violence calls or the lack of affordable housing. One other point that I want to make, a statistic that was in the report that I don't have a slide for, unfortunately, but there was a section on first-time homelessness. And the statistic that was cited was that 22% of those experiencing first-time homelessness were children or youth under the age of 18. And so if this is consistent with what you're seeing, in your area, I think this really is a statistic that brings home the reality of those impacted by homelessness. And unfortunately, on the flip side, an opportunity to advocate and to really appeal to the public if you're doing fundraising or, you're trying to appeal to policymakers. They're more apt to pay attention to stories that involve children or youth, unfortunately, and may be apt to donate as well if you can highlight some of those challenges. So if those were consistent with what you were saying, and I'm sure they were, because it was pretty consistent around the state. All right, can you change the slide? I'm just making sure. Is there anything in the chat, Allison, that?
Nope.
Okay, good. Thank you. All right, so now some gaps and needs. So just thinking about the opportunity to make your case. There's a lot of money coming into the state, both with the CARES Act previously, and now the, well, some people call it ARPA, okay, now I can't think what it stands for, but.
American Rescue Plan?
Thank you. American Rescue Plan Act. It's the federal act that was passed in March that has a lot of money coming to it, and hopefully we'll have additional funding for housing with the Build Back Better. This is your opportunity to make your case both with the state, with your city and county. IJ is independent jurisdiction and PJ is participating jurisdictions. Those are technical HUD terms, but it just means that, you know, another entity that has money coming to it. MCAH as well is having some of the American Rescue Plan funding coming. So opportunities to weigh in on what you see as priorities. MCAH is going to be putting a plan together for the home ARP funding and then offering a public comment opportunity so you can help identify what you think funding should be spent on and what the priorities are as you see it in your community. In terms of the state, the governor's office, the campaign to end homelessness and the Michigan Homeless Policy Council are making recommendations as well for the funding that is coming to the state, to the governor kind of policy team. And then CEDM, as well as other partners, CEDM is leading a group around putting together a prosperity roadmap that is a little more broadly looking at some of the infrastructure priorities, roads and bridges, broadband, funding for water systems, as well as housing and some of the other necessities that we see as lacking in communities. So those are definitely some that you'll want to weigh in on. And a little bit later, we will tell you about a webinar that we're helping put together on Wednesday to look at the ARP funding and how you as a community partner can help be influential in crafting some of those priorities. I did also just want to say, putting in a plug for, you know, making sure you're staying on top of some of the funding and some of the deadlines that are coming in. So I encourage you to be looking at your newsletters from HUD and from MCAH, from your county, maybe exec's office, from CEDM, and of course the coalition, so that in the campaign, so that you're not missing any deadlines and opportunities. I also did want to mention real quickly here that we are also always looking for testimonials from people. So we're interested in capturing first person testimonials for folks with lived experiences. So both for Homeless Awareness Month, which it still is this month in November, as well as COVID impacts and the SARA funding, which is the COVID Emergency Rental Assistance funding. So if you have anybody, any individuals or families that fall into any of those categories where, you know, you have a great story that you could share, we would love to capture that. One of our staff is a videographer. We can do it in, you know, video. We can virtually, you know, meet and capture the story. It can be, you know, written. It can be a variety of ways. So we're willing to work with you, but we'd love for you to connect with us to kind of elevate those stories and really share what's going on. Next slide, and this is, I'm going to turn it over to Eric.
Great, thank you, Lisa. So we wanted to talk a little bit about some of the practical resources that you can avail yourself of, because I want to make sure we're putting things into a broader context. When you are thinking about the messaging and how you are advocating, it's one thing to look at your local data and to speak to that local data, but also looking at regional or statewide trends as well, I think is important. That only reinforces some of the things that you already know, and that you show that it's a bigger issue that's a consistent issue throughout the state. in most cases, depending on what the specific aspect is that you're looking at. We have an advocacy toolkit through MICA that will be available. We don't have a link here for it, but on our website, you'll be able to find that. But I also want to speak to the National Low Income Housing Coalition. We have been working with them pretty closely over the last several years. They do provide an awful lot of support and resource, such as their toolkit for a program or initiative that they're pursuing. So if you visit that link, which will be something that's a hot link in the copy or the set of slides that are made available to you, you'll be able to link to get to that. That has a variety of materials, I think, that help to inform our talking points and the messaging that we have. And again, provides information on a statewide or national level, but also NLIHC provides some information that is a state breakdown. Through all 50 states, they have information that is pulled together that provides information such as, key facts, such as the percentage of renter households that are extremely low income. So if you're talking about your own community and the information you have, and then you can relate it to the state level data, I think that's important. You can see things such as the percentage of extremely low income renter households in the state of Michigan, broken out by several categories. People who are currently working, but are extremely low income renters. We have percentage of people who are disabled, percentage of seniors, single caregivers, et cetera. So there's some data that actually helps to provide a little bit more color to some of the data that you are sharing at that local level, and reinforces with some, I think, some pretty astounding data when you actually look at it. So I'd encourage you to take a look at both of those sources going forward to, again, tie that into what you're talking about at the local level. Next slide, please. Wanted to talk a little bit about some of the advocacy opportunities that exist. Right now, you're probably thinking about some of those things at the local level. How are you talking to city and county officials, or maybe you're just thinking in terms of your legislators in the House and the Senate here in Michigan. But there are some other ways that you can get very directly engaged. There are a number of issues that as an organization we're working on that you can be a part of and provide your voice to. An example of that is a source of income discrimination. In the chat, someone had asked about that specifically, the issue that folks are having to deal with relating to landlords who won't accept vouchers. This is an example where, as an organization, we're working with a group of people who are interested in the issue and addressing it. The group has taken on a new name recently, the Coalition to Expand Housing Access. If you're interested in participating, let us know. There are bi-weekly meetings that are taking place looking at that as an issue and developing a plan to address that, and working with the legislature for a legislative answer to that issue. So we're not just talking about vouchers there. We're also thinking about individuals who may be on fixed incomes that are receiving benefits of some kind. We all know that there are many types of income that are discriminated against. Vouchers, I think, are probably the low-hanging fruit when we think about that. Our organization also has a legislative action committee. Many of you may be familiar with it, but LAC meets once a month. It's an opportunity to get updates at the state and federal level, and it's an opportunity for you to share what's going on in your world and your communities as well. And then as part of the work that we do tied to the Legislative Action Committee, we have an annual advocacy day at the Capitol. We've gone virtual, of course, because of COVID, and may continue to do it virtual, but this is an opportunity for us to collectively engage and to contact legislators in a targeted period of time with some targeted messaging, which I think really strengthens the work that is done when we have some very specific priorities and messaging that's consistent, that we get a little bit more traction along the way, and encourage you all to participate in that, or to get some more information about it and consider how you and your organizations can be involved. Keeping in mind, you have data. We're talking about that now, and the importance of using the data from the data report, and also what you can generate at the local level that feeds to the conversations that you will have with a look through these types of opportunities at the state level with Advocacy Day. There are also a couple of other opportunities that we as an organization are involved in. Micah does head up the National Alliance to End Homelessness annual Capitol Hill Day event. We're co-leader on that. And then also the National Low Income Housing Coalition also has another version of Capitol Hill Day events, again, virtual. And I would imagine they will continue to be virtual going forward, at least in the short term. So keep those in mind. Those are great opportunities for you to be connecting with your members of Congress virtually through direct communication, talking about what's happening in the district, what's happening on the ground. And that really helps to, I think, educate and inform elected officials when we think in terms of what are the impacts, what is the data saying, what are the anecdotal pieces that you can bring to the table. Those are opportunities for people with lived experience also to join in the conversation and to share their personal experiences with elected officials. So just a number of opportunities for advocacy. I'm making the plug here. Lisa Chapman is our lead person on public policy, but I'm making the plug here for that. If anybody wants more information about any or all of those, please feel free to reach out to Lisa. Her email address is there at the bottom of this slide and will be available to you, of course, if you download the PDF of the PowerPoint slide deck. Okay, next slide. Lisa.
Eric, one more quick thing, if I can.
Sure, please do.
I'm just going along with advocacy. 2022 is an election year. It's not a presidential election year, but it's a governor election year and a lot of other key races. And so we will also be working with you to look at voter registration, how you can sign people up, voter education. Micah also does a candidate survey and try and let you know where the candidates stand on key issues around homelessness and housing. So look for more from us, and we'd love to work with you, all things election in 2022. So that's coming up as well. Right, a couple updates from us. I mentioned that ARP, American Rescue Plan webinar with CEDAM, we're hosting this Wednesday, December 1st. Oh my gosh, it's December already, at 12 noon. And I just also wanted to plug, the last couple of days of Homeless Awareness Month, November. So here is our lovely poster for this year. We have a toolkit for communities on our website and a calendar, and we're trying to capture all of the events that have been going on across the state in different communities. And if you did one and you don't see it there, please let us know. We're collecting pictures, and we're going to really publicize all the events that are going on. And this is really a prime opportunity for you to highlight your data and your experience and what you've been doing. So please let us know what you've done. All right, we can go to the next slide. And so another campaign to end homelessness webinar that's being hosted. It's a free webinar. It is on understanding adverse childhood experiences. You may also have heard the acronym ACEs. This is in partnership with the Michigan ACE Initiative and the campaign, and Micah is a participant, and we're sponsoring this on behalf. We have a great speaker, and that is coming up on Monday, December 20th from 1 o'clock to 2:30 in the afternoon. There's the registration link there. It's also been going out on every Friday on our Friday updates. We have all of the trainings and the registration there as well. Let us know if you can't find it. You can shoot any of us an email, and we'll be happy to let you know what's going on. You can go to the next slide, please. And so we just really want to hear from you. We want to know any examples of your advocacy using your data or talking with public officials or even raising funds, highlighting some of your unique organizational experiences over the last year. What have you been doing to partner with the community and help, innovate and change your practices because of COVID. Anyone want to chime in here?
If you raise your hand, we can also take you off mute if you'd rather
Yes.
speak than type.
Yes.
Let me also frame that a little differently. Are there any specific things that seem to resonate when you're talking to any of your elected officials with respect to COVID? What are the things that they're particularly interested in? If maybe you had any contact with elected officials, what are the things that they're asking about? Or what are the things that you think are important that you're sharing with them at this time?
We have a comment in the chat that Tracy is partnering with COTS in Detroit to help keep residents in permanent and affordable housing.
Fantastic. Cheryl?
Yep, I'm gonna take her off mute.
Thank you.
Cheryl, you're up.
Can you hear me?
Yep.
Hey, you guys. Hi. I'm from Jackson, Michigan. Just like Amanda's on this call too. She's from Community Action Agency. And what our town has done is using some of this CARE Act money. We understand, and you guys were talking about the fact that we have all these vouchers out there, but there's no places to put them. So they have put aside $4.5 million of this money and made the Affordable Housing Development Board and a housing trust fund for the city of Jackson to start developing and making transitional housings. They've got 5 city-owned houses right now that they are in process. We just approved it last Tuesday at the meeting, and Community Action Agency is involved in this and everything, where they're actually starting to revamp 5 houses to get some transitional housing going very quickly. So our community is understanding where the problems are, and we're all trying to work it out.
That's fantastic. That's really great to hear. Not only, recognize the problem, but then putting something in place to help combat. So that's really encouraging. I'd also hope that you all would look at permanent housing as well.
Oh, we've got the Community Action Agency has a lot of money into the permanent housing. We're just trying to, and I'm sure some of this will end up being into permanent housing. This is not a one-time thing. They've figured out some different ways to actually fund this, keep funding this program year after year after year out of different like tax things and that. So after the initial money is spent through the CARE Act, they will be able to keep this going for hopefully a long time. So they're really proud of it. Our mayor is the one that proposed it, and working with our Jackson Housing Commission and our Community Action Agency. So it is something that we're really trying to do to help our people here in our Jackson community.
Great. That's really fantastic. Not only that they took action, but also having a renewable source that sustains, and increases over time to keep funding available for that purpose for housing is really important. That's something that at the state level, the governor is also doing. We have a Michigan Housing Trust Fund that's been Community Development and Housing Trust Fund that's been, 2 times it's been funded with general funds. We're looking at a more renewable source so that ours can also perpetuate. Eric, you had some comments?
Yeah, I just wanted to piggyback on that because we're in unusual times in many ways. And one of those is the influx of resources that are available. And we're also in a time where COVID-19 has really shown a light on many issues that already existed, but really is showing how they've been exacerbated and are really glaring issues that most communities are facing. And the idea of trying to communicate with communities, I think it's outstanding. The city of Jackson is doing this, and other communities could do this. So when we're thinking about the messaging and what are we trying to advocate for, trying to be a voice with respect to communities focusing on the issue of affordable housing is one of those great opportunities that exists. There is money that will be available at the state level that we're hoping will go to the Housing and Community Development Fund, but that's just one piece. At the local level, that's another piece as well. There are additional dollars and additional things that communities can do to focus on housing, because this is an imperative not only from the standpoint of thinking about homelessness, but when we're thinking about economic viability for communities, et cetera, et cetera. That's the kind of messaging that is resonating now with elected officials. So trying to engage and talk about that specific issue, I think is really important and could be a game changer for us, because we know that one of the things that can be done to address the issue of homelessness is to see a much more robust housing stock than we currently have. We know that that's inhibiting people's ability to access affordable housing, or to get people out the back doors we talked about earlier. That really is showing how important it is to have access when the vouchers are available, and we cannot find housing for people to utilize their vouchers. That exacerbates the problem. We know that there is a proposed increase in vouchers coming to every state in the country based on the current Build Back Better legislation. If it passes, that will include a significant increase. And so that will be a good problem for us, but that just means we need to really step up our game when we think about housing as an issue, and being able to talk in terms of the impact of COVID and then post-COVID, in ensuring that we use this opportunity to be, once in a lifetime opportunity to really move the needle when it comes to homelessness through the expansion of affordable housing. I'm stepping off my soapbox. Next.
I'll just add that, in addition to the investments that are sorely needed for housing in communities, the source of income protections that the Coalition to Expand Housing Access is working toward really go hand in hand with the ability for persons to have all of their income recognized, whether it be a voucher or a veterans, benefits, VASH, alimony, child support. There are so many different ways landlords can say, no, I'm not counting that income, so the person doesn't qualify. So we have 4 bills that are pending, 2 in the House and 2 in the State Senate. And we are working very much with a very broad coalition from all across the state, but we could use every voice to help influence and really push these bills forward so that people can have protection against all of their legal income so that they can access housing. And as Eric mentioned, vouchers are just one of those sources. So a lot of other states in the country are doing this, and we really see it as really moving the needle forward in having housing more available to folks. So I'd also really love to have you join us if you can for that. It meets, we're meeting every other Thursday at 10 o'clock.
Do you want me to put my email in the chat box so you can send me a link? Okay, that'd be great. And I can do that. If anybody from any other cities are interested, all they have to do is go on the City of Jackson's website and look up these council meeting minutes. And it would be the last 2. It would be the November 23rd and I'm going to say that and I don't have it handy with me. And the November 9th. And they'd be able to read the whole ordinance and the modifications they made and everything. And they could, kind of replicate that and try to take it to their council. So.
Fabulous. Well, we'll help highlight that great example.
Okay, thanks so much. I'm gonna mute myself now, and then I'll just put my email in the chat box. Thanks, guys.
Thank you. Very exciting. Anyone else have any either things you're grappling with? It doesn't have to be a huge win. It can even be a small one or something that you're thinking about for your community as an opportunity. All right. I know Home has some funding available, the Home program through HUD. Mishta is going to be putting together something, but it also has a strand of funding. Thank you, Cheryl. A strand of funding, a line of funding that will help fund non-congregate shelter. So if you have a local, maybe a motel that is vacant or some other kind of, I know sometimes convents or, mother houses or, religious buildings can be repurposed, schools that are vacant. So that's something to keep your eye on as well. All right, why don't we go to the next slide? Just want to, couple more plugs. Just don't forget we have our Legislative Action Committee next Monday, the 6th at noon. If you want to join us, it's always the first Monday of the month. Really want to thank you for your interest and participation. And I did want to turn it real quickly back over to my colleague, Allison, to talk about how you can be a member of MCAH.
So I hope you enjoyed this webinar today. If you did, we are able to offer things like this because we are a membership-based organization. So this month we actually provided 4 webinars, I believe, that were all free, which is, takes a lot of organizing time and other stuff like that from our staff. We do offer at least 1 free webinar a month that we offer just for free to anyone that is able to come. And all of those things are brought to you through our membership. So we would love it if you would join as either an individual member or an organizational member. The links are in the chat. You can find information on our website. You can contact me if you have questions. There are benefits, personal benefits that you could get by becoming an individual member, and also some that your organization could benefit from as an organizational member. This is not a listed benefit, but some of the benefits are us being able to offer things like this to you free of charge. So we just want to make that plug and hope that you will decide to become a MCAH member this year. And with that, I believe the webinar is over. Don't forget our next free webinar is December 20th on ACEs. We have the CDM partnership webinar coming up. So a lot of good stuff. You can find it on our website. And again, if you want to join our mailing list, you can also email me and I can get you added to that. We send out at least 1 email a week, but sometimes a couple more to help folks stay in the loop. All right, thanks so much. And I hope you enjoy your week and really appreciate you giving us your time today. Bye-bye.
Thanks, everyone.